at Dartmouth-Hitchcock want to congratulate you on your new baby. We know you have a lot to think about as you get ready to bring them home, including preparing their feedings. Properly preparing their feedings ensures that they get the good nutrition they need for growth and development. Children's Hospital at Dartmouth is a baby-friendly hospital. We support and encourage breastfeeding. However, we understand that sometimes formula is necessary. Improperly mixing your baby's formula can lead to health risks. Please be sure to follow the correct recipe as directed by your care team. Before you begin preparing your infant's feedings, please be sure to wash your hands and clean your preparation area. Ensure that all the measuring equipment has been appropriately washed and cleaned. To measure your liquid ingredients, please use the liquid measuring cups, a syringe, or the measuring spoons. Check with your provider about whether to use boiled or sterile water to mix your formula. To measure your dry ingredients, please use the included scoop in your infant formula, dry ingredient measuring cups, or the measuring spoons. When making your breast milk fortifier, it is best to prepare this in smaller batches versus a 24-hour supply. Also, what I'm demonstrating is for demonstration purposes, so please refer to the recipe from the registered dietitian. The first part of our recipe calls for 2 ounces of breast milk. So we're going to add 2 ounces to the liquid measuring cup, and be sure to look straight on at the measuring cup to ensure an accurate measurement. Next, we're going to add the dry formula. Our recipe calls for 3/4 of a teaspoon, so we're going to use 1/4 teaspoon and a 1/2 teaspoon. When measuring the dry formula, we want to scoop. Do not pack the formula unless your recipe instructs you to do so, and level with a spatula. We're going to add this to the breast milk. And then 1 more 1/4 teaspoon, level off, and then add in. When mixing the breast milk with fortifier, be sure to use a spoon to stir. Do not vigorously mix with a spoon or a whisk, as this can cause the breast milk to separate. After preparing the breast milk, you may serve it immediately. Any leftover fortified breast milk can be stored in the refrigerator for up to 24 hours. For demonstration purposes, the recipe that I'm going to follow today is 2 2/3 cup of water and 1 cup of infant formula. Please follow the recipe given to you by the registered dietitian. So I'm going to add the water in. Please make sure to look at the measuring cup straight on to ensure an accurate measurement. 2 2/3 cup. Next, we're going to add the dry infant formula. We have 1 cup. So we're going to measure out 1 cup of the infant formula. Please do not pack the infant formula in the measuring cup unless you've been directed to do so on your recipe. Level off the measuring cup with a spatula to ensure an accurate measurement. Next, we're going to add the infant formula to the water, and we want to use a whisk to combine. You can store the infant formula in a large container or in individual bottles in the refrigerator for up to 24 hours. If you have any questions regarding fortified breast milk or higher calorie infant formula, please do not hesitate to contact the registered dietitian or the nurse to explain to you how to properly mix formula. Congratulations on your new baby.